Thank you all so much for being here. My name is Molly Williams, and I'm the Director of Innovation and Entrepreneurship with the Greater Newport Chamber of Commerce. I run programming and events here at Innovate Newport, so we're thrilled to have you here. This event is the second of a series called the Industry Spotlight Series, which every other month we spotlight a different industry in Rhode Island. And last month, February, was the food and beverage industry. Obviously today is MedTech. We will also have future ones on energy and defense. You'll see a slide at the end for dates, so mark your calendars now. It's so exciting for us because this is about pulling together the ecosystem and supporting people. So we have a lot of people from different places here today, so I'd love to just get a sense of who's in the room. So if you are a startup, if you're an entrepreneur, can you please raise your hand? Awesome. Amazing. And I hope you got a chance to check out the exhibit tables out there for our MedTech startups that we're featuring today. There'll be time at the end of the event as well to visit them if you haven't. Highly encourage you to have those conversations. Raise your hand if you are an organization that supports startups. Raise your hand. Wow, that's amazing. That is awesome. Raise your hand if you're an investor. Wow, that's amazing. Fantastic. How about come from college, university? If you're an investor. Great. How about just a curious citizen wanting to learn more? Amazing. And you can be raising your hand for multiple things. Great. Well, thank you so much for being here. We're thrilled to bring together the ecosystem, support it. Hopefully this is the first of many more times we have you here at Innovate Newport. I do want to say a few thank yous. Kevin Buck is our community manager over here. He manages Innovate Newport, so if you ever have questions and interest in the space for meetings or events yourself, please, Kevin's your man. And we have two interns here today, Taylor and Melinda. They've been amazing, amazingly supportive. Thank you both so much. Thank you to our advisors who have helped help us figure out who needs to be here, who needs to be on the panel, who needs to be invited. We couldn't do it without you. And thank you for those partner organizations who share the vision of and the mission to support entrepreneurs. So it really is all about the community, and we're grateful for that. It's fun working with everybody. I also want to thank Steve Kirkpatrick, Ann Sinzdukey, and David Altunian, who have really helped to plan the whole series. All the details, I'm so grateful. Couldn't do it without them. Okay, and without further ado, I really need to thank our sponsors. We have People's Credit Union, Business Development Company, Octo PD, and Full Sail Management, and Lock Lord are our series sponsors. Thank you so much to them for their support. And we also, I do want to mention that Newport Craft and Island Time Catering sponsored the food and beverage. Hope you got to enjoy some of that. If you didn't, definitely taste the food before you leave. And I believe we have someone from Lock Lord here today. Taste the food before you leave. Nope. Okay. All right. Well, without further ado, I'm going to introduce our moderator of the panel today. Aidan Petrie is the co-founder and managing partner of NEMIC, New England Medical Innovation Center. Welcome, Aidan. Thank you so much.
I think that was me in the younger days. Okay, well, this is an interesting group because I think I know at least 95% of people in the room in one way or another, and some of us go a long way back, and some of us are new in our circles. So I'm going to talk today. We're talking about MedTech. I've got some fabulous folk who are going to talk about their current experiences, where they are in the journey, and so forth. But I'm going to give an overview of essentially what we do at NEMIC, and we have. So let's just go down that path. And I always sort of temper this by saying, you know, some people know a lot, some people know a little. I'm kind of going to try and cut it in the middle here, so you know, we've got a reasonable balance. So I've been knocking around Rhode Island for a lot longer than I expected. And I think 40 years now, one way or the other, and have gone through a cycle of doing a master's at RISD and then carrying on from there to start a first coupling up with a very entrepreneurial individual and going on a wild adventure, which took us eventually to starting or transferring a company into the MedTech space, and that was Zymedica. And we ran Zymedica for about 20 years, and then sold it in about 10 years ago, I think. And in looking around for something to do, we went. I met up with a lady who's sitting in the red chair over there, Lydia Schroeder, and Lydia and I went off, and much to our surprise, we started a non-profit, and the non-profit is focused on educating folk in the medical device space. And just in this little landing spot, and I think almost everybody knows this here, but the medical device space is governed by a very particular part of the FDA, and it's basically devices, diagnostics, digital health products, etc., that are beneficial to your health, either as a therapeutic or a diagnostic or something like that. And so a few of those products are up there. And there are about 20 people in this room who have probably worked on some aspect of that. Our organization is there's Lydia and myself. I have the interesting moment in time where our executive director is also my daughter, which is literally my first ever boss is my daughter, which is a bit of another life's nice surprises. And then we have a powerful board, including Anne Schmaltz, who's in women's health. Hope Hopkins was involved in Mass Challenge. Mike Pereira, very deep in the medical device business. And Bharat Ramratran, who is the head of research for Lifespan. But and what we do in the core of the nonprofit is education. And we set this up because we had seen in our careers a lot of folk who had wonderful ideas, meaningful ideas, but they didn't actually know what to do with them, and they had gaps in their knowledge about how to get funded and so forth that were material to their success. And so the nonprofit is at its core is education, but you then go around that and you've got to do gap analysis, you find out what people need. We have an incredible network of individuals in the state who we're able to then connect them with. We have received, we're funded by, largely by Commerce Rhode Island and the Department of Labor and Training. And over the last, I think it's 4 or 5 years, we have raised, we've worked with a myriad of companies, over 360, have pushed through grants to them. So we're a pass-through. Money comes to us, we say, this is how we think you should spend it, and that money then goes to whoever they're going to spend it on. And this was self-reported by companies. Over that time, the companies we've worked with that are in Rhode Island have raised $105 million. We think that probably is a low ball, but so they have gone on to bigger and better things. Our progress essentially, just a few little highlights. The education platform has now been adopted by edX, which is the Harvard and MIT online platform. So it is now available globally, and we have 26 components of it and so forth. In our accelerators this year, we have over 40 companies. And they are covering, so if MedTech is at the center of it, we're also interested in health tech, where we think we can also be useful, and so we're running a program on women's health and women-run businesses and minority-run businesses. So it isn't, we can work at the technologies that need to be delivered at the top of the pile, but we also, there are things that one can do in the system, but we also, everything can't be a brand new technology that needs 100 million to get it out there. Some things are just can be improved at every level. So we're pretty rangy in that. Our approach is essentially that we will meet somebody. We have a rule: is we meet with anybody for half an hour. We don't necessarily meet them second time, but we'll meet them with half an hour. And our feeders are coming out of Brown and URI. They're coming out of people's basements. They're coming. We don't really mind where they come from. We assess what they need. We then put together a program, and then essentially from there we go through education, advisory, help them with fundraising. Most of the technology companies are going to have to raise 5 million, 10 million. Other ones are just going to have to sort of improve how they do their business. And the outcomes have been we've formed lots of companies, written lots of IP, created jobs, and so forth. Just very, very quickly, the reason MedTech, I think, is important to Rhode Island is that the ecosystem that is needed to support it is already here. And so when we look at a simple product like this, which is to give a lumbar puncture to a very small baby, which is a difficult thing to do, and you look at all the companies that have been involved in bringing that, every one of those, everyone except the manufacturer is a Rhode Island company, and it includes all the packaging, the labeling, the distribution, the regulatory people, of which Tom is in the room here, design, quality, etc., etc. Every one of those companies was a beneficiary of money coming through the system that we laid out. That company raised 900 million. It is on a big. I wish. It was started by two guys at Women and Infants, and the concept was posed to us by them. They raised 900,000. They're on the market. They think they're going to be in break even by August, and it's rolling on. So that is a relatively simple one. Dom Messerly is another. He's raised 7.3 million. He's got 5 full-time employees, has hired 12 contractors, and this is a bigger play. It's essentially a way of rehabilitating the vertebral body after a spine fracture with a natural bone implant. So it's like a kyphoplasty, but it uses natural bone. Same deal. So almost all of that money has gone through passed through into the system as a whole. We're an ecosystem play, so this isn't that we've got a wonderful team here, but at the same time, it's about the network, and it's about having companies and so forth that are able to support. So we're just always making connections, finding money, making connections. And on this graphic here, you've got all the universities, lots of service providers, funders, et cetera, and that's really what you need to make these companies, bring these companies forward. You will also see we do office hours up at MIT every month. In the future, we would like to give companies at MIT a reason to move down to Rhode Island. I think we can do that. And we work a great deal overseas. So we've had 60-odd companies come from overseas to Providence, and some of them for as long as a month. And they are getting education, they're introducing themselves into the network. The interesting thing with companies coming in from overseas is they're usually technically far along, they're pretty sophisticated, they've been through the development cycle somewhere else. And so we see that as an important part of our role. So as I bring this, I don't know how am I doing for time? All right? Okay. This is what we found, and I'm going to say, having had a company here, I didn't know all of this, but we've got a well-developed professional network that is in place and it's accessible. And if you go to Boston, you wouldn't say the same thing. So this is in Rhode Island. We can, that sort of, I know a guy conversation is actually real and it's useful. And we can get on the phone to people quickly who are specific to the needs of a startup. we've got a strong knowledge base here. We got good education programs. We're centrally located between, basically in the biggest MedTech hub in the world, which runs between New York and Cambridge. It's an attractive spot to be with relatively low, it's going up, but it's relatively low real estate. Good academic institutions who are specific and knowledgeable in particular areas, again, which is something we need to sort of drill down into more. We have a investment ecosystem locally that is growing and it is building as we go, and we would like to see that build more. And we think this is a very attractive spot for soft landing for overseas companies. A lot of it because of that sort of accessibility and being able to find people relatively quickly. So once again, our accomplishments in our pilot run are, we've mentioned, we are now getting much more interested in the future. And this is going to roll into Neil being stood up here. We think that Rhode Island can be viewed as a center for excellence in MedTech development. We think we've got all the relevant parts here, and to attract companies to Rhode Island, to retain them in Rhode Island, which is a key issue. And companies, we can build them up. We think that if with enough funding, we can then root them here in Rhode Island if they've stayed long enough and can build here. And what we need is a seamless single communication point for companies, so everybody knows that well, go talk to Nemic, and they will put you on the right track to the right place. A centrally located hub, a connected ecosystem, supporting grants and investments. And this is my role in Neil. You ready?
Sure.
Yeah. With the help of Neil Steinberg.
About the 85th time he's asked for money.
With the help of
I'm immune.
So, weirdly, Neil and I go way back. Neil was our first banker when he was at Fleet, and we started our first company right out of RISD, whatever it was, 40 years ago. So I'm going to sort of throw this to you initially, just to start off by giving, kind of how did you get to the point that you're the chair of this group?
Yeah, great, thanks. I've already learned something. I'll give everybody an hour. And I'm trying to figure out why I'm running out of time. You only give me half an hour, so I may adapt your half an hour. So it's great to be here, great to be in Newport. Interestingly, I was a Fleet banker, and then I was studying with the Rhode Island Foundation for 15 years. And we helped fund Innovate Newport in this building. And I remember coming down here when it was still the Sheffield School, so things have a way of coming around. 2.5 years ago, I was introduced, when I was at the foundation, to two people, Bob Coughlin and Travis McCready from Boston, who worked for Jones Lang LaSalle, big real estate company, focused on life sciences. And the important thing, though, was that both of them had a history working for Deval Patrick decades before, and one of them headed Mass Life Science Center, the other Mass Bio, and they were there at the beginning when they built up this sector. And they said to me over lunch, how come we haven't built up this sector in Rhode Island? So I'm not that smart. I didn't know. I had guesses. You know, I know there's obviously was activity. I even knew about Nemic a little. I said, I'm not sure. I said, the only thing I do know is that I've been in downtown Providence at the time for 45 years. I've heard about the spillover from Boston for 45 years, and I never saw it. With all due respect to everybody that says they were going to do this and that, we never got it. So they offered to do an analysis with their consulting arm on the kind of ecosystem here, what it would take, a SWOT analysis, basically. And they came back with a pretty quick SWOT analysis, and the plus was, companies that were working with Nemic, some in other life science areas, obviously the universities and the hospitals. Weaknesses, the tech transfer at Brown URI stinks. It's deficient. They know it. They just haven't done anything about it. We don't have wet lab space, and I know this Aiden tunes out when I talk about that, but we're a market where if any of the two of us wanted to start a biopharma type company, we do not have commercial incubator lab space. They go up to Cambridge. There's a company, Bolden Therapeutics, came out of Brown, headquartered in Providence, and their research labs are up in Cambridge. So anyway, that came out, and when we got it, 2 years ago in January, we presented this report. And I can remember, it was a Zoom, it was the governor, the speaker, and the Senate president. I got them all on there for half an hour and said, hey, just take a look at this. Out of that, the Speaker Shikarchi, got very excited. And he called me up and said, let's go the next step. I said, okay, no idea what the next step is. But what would it take for Rhode Island to build this up? And I don't want to say start it, because obviously there's a lot already going on, but it's like a lot of things in Rhode Island. It's small and it's disparate and it's all over the place. So we hired another person to work with us to put together a business plan. It is a copy of Mass Life Science. The Mass Life Science Center that's been around, quasi-public organization, partners with Mass Bio, very successful. That's the structure that we copied. And what was important was being a quasi-public organization, not in state government and not in Commerce RI. And we pushed that through. Then the legislature, under the Speaker's guidance and direction, wrote legislation that got passed last June. Before it got passed in the spring, he asked me if I would chair it. Now, I was retiring June 1st from the Rhode Island Foundation. I was not looking for a big gig. I was looking to read a book on the beach. And, but I said, yes, I'll help get it started, and had no idea what I was getting into, because it's been forming a startup. So the legislation got passed. I couldn't get approved until the Senate came back in January for advising consent. We're writing bylaws. It's a startup. It's a startup state agency. But it's a really, a lot of commitment. So the governor allocated $45 million of ARPA money. That's the recovery money, COVID recovery money. And the significance of that is we have 2.5 years more to spend it. It's not in the state budget, annual appropriation, use it or lose it type thing. So the money's there. The board consists of the presidents of Brown, URI, Rhode Island College, the CEOs of Lifespan and Care New England, the dean of the medical school at Brown, somebody from Vertex, and big companies, somebody from Amgen, and other people representing labor, accounting, and whatever. And I'm the chair. The Secretary of Commerce is the vice chair. So that got formed. We had our first meeting in January, our second one February, next week is our third meeting. Half of what we're doing right now is writing bylaws and getting insurance policies and everything. We don't have the money yet. Trying to get the money has become a full-time job. Where's the cash, right? So any of you who've worked in state government, I could do 2 hours on that. But you know, I come from a position, and the reason why I was asked, and it has nothing, I know nothing about this sector. Nobody's figured out that I last had biology as a sophomore in high school. I don't know it. He tells me, I just believe it. And so what I can do, though, is organize stuff and get stuff done and push it through. And my role is to be an expediter. So we're ongoing 4 purposes for that money spelled out in the legislation. So one is to get this organization a copy of Mass Life Science on a smaller basis going. So that means hiring a CEO. Search has started. Korn Ferry's doing the search. If you know anybody that might be interested, that you think we should look at, this is somebody with industry knowledge. It'll be business development oriented that can run an organization. And we're pushing. We want to get somebody identified. I'm pushing them for mid-May so that we can get it through the legislature before they go home in June. And that's number one. And they'll be staffed with 3 or 4 other people. Number 2, and this is not in any particular order, workforce development. We do not have the workforce. We may have the workforce in specific companies, but broadly across the state, we don't have the workforce. And this is not just PhDs and MDs down in the jewelry district. It's lab technicians. It's at all levels. Third thing is this wet lab space. We are mandated to stand up an incubator wet lab space. We're doing it now. The universities have their own, the hospitals have their own, but there is no commercial space that can be an incubator. Now, whether we also partner with a bench incubator for devices, something we can look at, but this is a specific charge to do that. I got a call from Providence Business News, I don't know, a month ago. They read an article in Boston, in the Globe, that there was a glut of lab space. Okay? They called me up, are you concerned? I said, I wish we had a glut. We don't have anything to have a glut of. There's nothing there. So our model is Worcester. Worcester, Massachusetts is the 15th largest life science center in the United States, second largest in New England. They're an incubator they've had for 10 years. And what the UMass Medical School and WPI are doing dwarfs. If somebody, I don't care if the CEO's lifespan and Brown were sitting here, dwarfs what we've been able to do here. Our universities tout NIH grants. That's wonderful for them. It's big federal money. It doesn't come out the side as business, though. We need companies here. And then the fourth thing in there is to develop a fund. So we are going to start a fund. I don't know, I'll pick, not to be held to it, $10 million. And we have to figure it out, how to run it, whether it's going to be investments, whether it's going to be grants, or whether it's going to be loans. And so we've got some people working on that. All this we're trying to push as quickly as we can. The biggest thing for me personally out of this is I knew a lot of people in the state. I know a lot of people in the state. I've been around a long time. 90% of the people I meet every single day, I don't know. Many of you in this room, in this sector. It's very exciting, the people that are here. I've joked that I'm going to take the train to Boston a few times and just market this on the way down the aisle. But there's a lot of talent. There's a lot of interest. Again, Aiden has done a spectacular job. Before we even got this started, talking about the device, easier to get up and running than a pharma company that may or may not work. But we've got to be able to do all of this, and we need to figure out what Rhode Island's good at. I talked to the dean of the medical school, it's mRNA. Somebody else will tell me cancer. Somebody else will tell me brain science. Medical devices actually is the easiest one as an old banker for me to understand. I go over there and see it, I can understand this stuff. The other has to be explained. But a lot of talent at URI. I'll give you an example. The company at URI, I went down there. I don't remember the woman's name, senior faculty member. I don't remember what they did. Really cool stuff. Very advanced, had a couple of rounds of funding, partnering with Yale. Not partnering this way. So the other message I just quickly would like to put out is we need to make this a statewide effort. So I push back all the time with my friends down in the jewelry district that they are not the epicenter of the world. There's research being done there. Our biggest company in this sector in the state is Amgen in West Warwick, Rhode Island. And I remember when they went there, they didn't go there because there was great research going on. They went there because we had water and land, and they needed a big space. And there's others in Lincoln, and there should be down here, and I'm probably not familiar. But we need to make this smaller. We want to make sure that people from Newport, from Providence, from URI, everything's 45 minutes away, and we act like it's 3 days. When I was with the foundation, I used to come to Newport to speak. My opening line was always, I'm not staying over. And it would always get a laugh, right? Because people think that you're not going to come from Providence. So I know I went on, but we want all of you to be involved. We want advice. We want interest. We're going to do a big event at the end of May that gets everybody under the tent from all the different aspects of this and put us on the map. I told the governor, I said, Cambridge and Boston won the Olympics. We're trying to qualify. Now, some of you may have seen, Governor Healy recently announced that she is proposing Life Science 3.0, trying to do 1.0, for $1 billion over 10 years. That was Deval Patrick's original commitment, $1 billion over 10 years. And I immediately fired that off. The governor, the speaker, the Senate president. But what I emphasized was not the $1 billion. They're 6 to 7 times our size. It's the long-term commitment. I take $25 million a year for 10 years. It's the 10 years, the commitment that we need to do here and grow this industry over time. And the last thing I'll say, and many of you have been here a long time, and this is more the old banker speak. I don't believe the state of Rhode Island ever moved on from jewelry and textiles. I was a banker for umpty-ump years. Those were still big industries here, and they left for various reasons. You tell me what industries we've grown besides tourism here. Now, it may be wind, it may be ocean tech, and it may be this. We've got to grow some industry here, or we're not going to keep the people here. We're not going to have the economy.
So Neil, before I head on to Dave, if 5 years' time, what would success look like for this effort? What would you like to see changed?
Yeah, great. So, the traditional is more companies and more employees. We're not going to steal companies' big corporate headquarters. What we're going to do is get the second or third research or manufacturing. I would like to see us established as a science center with the brains, as a manufacturing center. One of the things that Governor Healy said a month or so ago was they were going to focus on blue-collar workforce and manufacturing. If I had to write the history of Rhode Island economy, it's blue-collar workforce and manufacturing. So growing companies, being welcoming and a place to start, being welcoming for people from Australia to come here and set up, and growing. And growing is a trajectory. It's not a firm number, but in a long-term.
Yeah, brilliant. Thank you.
Okay.
So I'm now going to hand this over to Dave. Well, I actually didn't know. I think so. Dave. We'll find out. Well, I actually didn't know. Dave Robeson and I worked together for 17 years, and just moved on to a tremendous story that he's going to tell you about now.
Good evening, everybody. I will keep this high level and just fly along my slides here, and if you have follow-on questions, you can find me afterwards. So our little company, there's about 25 of us now, right next door to PPAC, so if you're going to Super Hosting later this week, you can come by and say hello. We were founded in 2019. Can you hear me okay? There's about 25 of us. We're using an awful lot of local service providers, so if any of you are here tonight, thank you very much. There's plenty of services that we can't get from the Rhode Island state area, and I could share a list with you at some other point. But we're taking advantage of those network potentials as Aidan was just describing. Our clinical focus is reducing intraocular pressure, so the pressure within the space underneath behind your cornea. By reducing that pressure, if you have clinically high intraocular pressure, you run the risk of contracting glaucoma, which is a gradual deadening of the central eye nerve, and that is an irreversible problem, and you will eventually lose some or all of your sight. This is a multi-billion-dollar problem that's throughout the world. We're just concentrating in the U.S. We have developed a surgical implantation of the first biotissue stent to be used, as far as we know, in the body anywhere. We happen to be putting it in the eye. And again, if you stop by my little table afterwards, I can give you more details on that. There's a video to watch, etc. So moving on. Lots of publications out there in the field with surgeons writing their research up and their responses. This is one of the fastest growing spaces within glaucoma. It's referred to as MIGS, which stands for micro-interventional glaucoma surgery. We're going through very tiny incisions in the eye in order to deliver a therapeutic treatment rather than opening up the whole corneal space or having to make big incisions on the sides of the eye. According to MarketScope, this is in our data, this particular business space will double over the next 5 years and become quite large, at least from our perspective, at just about $2 billion. There are a number, so I'm realizing that you can't really see very much of what these slides are showing. There are a number of large potential acquisition partners, we'll call them, big fish that do not sell product into the MIGS therapeutic space. And their competitors do. So we end up being attractive to them as a way for them to get into a space that they're not in already. And you wouldn't be surprised to hear that some that are in the MIGS space might want to acquire this because they might think it's a better mousetrap, a better solution. Some of the payment codes that we have established pay more per surgery, which doctors and surgery centers really like. So it's a big potential. We think that we've knocked down most of the things that would prevent us from being successful. Payment codes, as I just mentioned, patents are protecting our space. Lots of clinical evidence that, of course, helps make the case that this is a good idea. And we raised 24 million in 2022, a little bit before that, and that's given us a nice track in front of us, a well-funded position to do this work. We have 2 different products. You'll see them at the desk if you stop by. We have 12 and 18-month data that's showing very good residual results. So if you have a surgery and your pressure goes down for 6 months but then goes back up again, that's not a success. We want to see 12, 18, eventually 24-month data. There's a variety of different articles that have been published. We'll be in full scale in 2025. Go Rhode Island.
Great.
And Dave, I was when I met your your founder the other day, he basically is delighted with you and said he was basically viewing Rhode Island as and the lab here as his development office.
Yeah, I'll wax on 1 second on that. So if great things happen and we do manage to sell out these products, we've already committed as a management team to figuring out what to do next, because we've compiled a really good technical team that now knows more about the superciliary space, you can look it up, in the eye, than just about anybody else on the planet, including the Schlemm's canal, which is close to the superciliary space. So we've had to learn the hard way how to manipulate things in the eye, and our founder, who was a surgeon extraordinaire and hit the backers and the board that we had, wouldn't want the team that we've developed here in Rhode Island to sort of fade away. So this would be one of those, fine, everybody, take a break, and now get back on the horse again. So the expectation is that we stay in Rhode Island for a long time.
Excellent. Melissa, another great friend from, I don't know, probably 12 years, many years. Great friend.
Going to shift gears. We're going to talk a little bit about saving moms' lives. So I'm Melissa Boley, CEO and founder of Flourish Care, and we're transforming maternity care. We're doing that through a B2B tech-enabled maternal health care company, and what we do is we partner with leading health plans and leading health systems, ultimately to offer reimbursed doula support. And reimbursement is a key thing to note here. For the longest time, this type of care was not being reimbursed, and Rhode Island was the first state in the country to provide full reimbursement for Medicaid and commercial doula support for all women in the state of Rhode Island. And that just went live about a year and a half ago. So this has been a huge driver for our business. And ultimately what we're doing is we're providing that wraparound care. So when the mom leaves the hospital or the mom is pregnant, who's really supporting her in between those OB visits? And that's really where this care comes in, and it's saving lives, it's improving outcomes, and it's reducing cost of care. The reason I started the company, my background's biomedical engineering. I have literally no reason to be in this space, to be honest. I was like, I see a problem. So I spent 20 years in healthcare, health tech, doing medical device development, both in the lab, doing R&D, and then moving into sales and marketing at companies like BD, which is what brought me to Rhode Island, and then Zymedica. And I found, going through my own pregnancy journey, that I really struggled. I was like, I've been in healthcare, this is going to be a breeze, and it really was not. It was like navigating the healthcare system during pregnancy, birth, and postpartum was really challenging, even for me, who had all this experience. So immediately, I reached out to a friend of mine who also worked at Zymedica at the time, Beth, and she's an engineering buddy, and she's like, I really think you would benefit from a doula. I was like, do what? What are you talking about? I've never heard that term. I've done all the research. I spent all my time in clinical research. What are you talking about? I went back. There's over 500 peer-reviewed articles that adding a doula to your team reduces NICU rates by 50%, reduces C-section rates by 30%, improves postpartum anxiety and mood disorders, decreases it by 50%. I was like, how is this not standard of care? And Rhode Island is the first state that actually is making this standard of care, and we are enabling that to happen. So, is this a big market? Absolutely. There are 4 million women giving birth every year, and this is not just a how do we save moms' lives, how do we prevent maternal morbidity and really the worst case scenarios from happening. It's very costly, the system. So if you think about every time the baby goes into the NICU, it costs $77,000 on average for the baby to be in the NICU. And so if you can really reduce that by 50%, you're saving a ton of costs on the system, and that's why you're seeing reimbursement come into place. And so Rhode Island started it. There's now 30 states across the country that are now reimbursing for these services. So our plan is to start here. We just expanded to Massachusetts for 25,000 pregnant lives through our next contract, and we're expanding across the country with our solution. So there's a huge problem here, and we're ultimately solving it. So what this looks like is ultimately an 18-month long wellness program that starts at about 12 weeks pregnant, and it goes through about 12 months postpartum. We provide in-home, in-person, and telehealth support, and we ultimately partner. Our biggest partner is actually Women and Infants, again, another Rhode Island amazing partner, and we do these seamless hospital integrations. So every single OB is telling their patients, New standard of care. You get me at the hospital, you get a doula based in your community, and this is all covered by your insurance. And guess what? 60% of people are saying, yes, please sign me up. And this is within a Medicaid population, which is very, very difficult to engage. They are really, really excited about this care. And we have evidence-based wellness programs. We've been doing clinical studies. So really the goal is to roll this out across New England and then the broader country. So our interim results show that people are enrolling in our care and our services 10 times the rate of the national average. Only 6% of families get access to doula care today. In our studies, it's 60%. And within Medicaid populations, that 6% actually drops to 1%. And our study was 60% within Medicaid population. Patient satisfaction is through the roof, and our partners absolutely love us. So how, again, do we make this the standard of care, and how do we roll this out across all the major clinics in New England? As I mentioned, this looked very different 2 years ago. There were only 2 states reimbursing, Rhode Island being the first one that required, as a state law, that Medicaid and commercial insurance actually provide the support. Now there's 27 states. They reimburse up to $3,200 per patient through those 18 months. That's huge. And ultimately, there's a $3.8 billion market that's growing now, which is really, really exciting. So we've raised 1.5 of our $2 million round, which is great. Money's in the bank. I literally don't believe it until the money's in the bank. So we're actually hiring right now, mostly from Rhode Island, which is really exciting. So our marketing team, our fractional CFO, we've got an amazing go-to-market strategy person from one of the incredible Quilted Health. It's a clinic-based solution. So we're really going to build out the technology, sales and marketing, and our clinical operations team with the funding, and we're excited to just keep trucking.
Thank you. And on the fund side, how did Rhode Island participate in that fundraising?
So Rhode Island's been really supportive through the entire journey. I started at SEG a couple of years ago and then won the Rhode Island Business Competition. We got funding through that, which really kick-started the company, and then we pivoted to insurance coverage, which has been huge. The funding, they've actually contributed about 1/3 of our funding, which is really, really impressive. So about $500K we got through Rhode Island funds and through Rhode Island funders, which I didn't actually think was going to happen. So it's really exciting.
Yeah, fantastic.
Yeah.
Peter, you're the local business to Newport, if you'd like to take it away. You're the local business to Newport, if you'd like to take it away.
Well, good afternoon. My name is Peter Neukins. I'm a serial entrepreneur. I'm an example of the transplant from MIT based down to Rhode Island. And we're excited to be here. My life changed when I was 2017, when I was diagnosed with Parkinson's, and I decided at that point to go and to use my extensive background in material science, solid state physics, biomedical engineering, to address the disease head on and reverse the Parkinson's disease non-invasively. A little bit about Parkinson's. It's a degenerative disease. It's progressive deterioration of the brain and central nervous system. It affects balance, movement, memory, mental acuity, and respiratory. And it's usually fatal, that is until iris. The $1.2 million market size and $10 million globally with a therapeutic market value of $7 billion and societal impact of $60 billion. We have a novel approach going on our background in biomedical engineering, and we use photobiomodulation to non-invasively restore the brain state. It turns out that near-infrared technology of the proper wavelength can penetrate the brain deeply and add to the mitochondria energy. And most importantly, we can also modulate the brain waves, which in Parkinson's shift in frequency and and start to become inefficient in clearing out the toxic proteins. So we restore the brain's mechanisms, and I've been doing this therapy for 3 years and have gotten dramatic results. We have 2 patents and with 54 claims, and what the innovation is to be able to sense the brain wave, set the emitters to the same frequency, and pull it back in. And it especially works well with at sleep, because at the N3 stage of your sleep, which is where you have the very low frequency of oscillation, if you don't have that, your lymphatic pathways and your lymphatic pathways don't jettison the alpha-synuclein, which is the characteristic propagation of the toxic protein. We optimize the intensity, frequency, and modulation. And we're a big believer in, if you want to understand the laws of the universe, focus on energy, frequency, and vibration, Nikola Tesla. And we've been maximizing that and following that to very good success. Our patents are mostly involved in being able to measure stimulus from the brain and servo the emitter system within a biological time constant. And we own this space. Most importantly, the actual headband that we're developing, it only requires 10 minutes in the morning and 10 minutes at night and before bed. We've only tried this on me. I'm a sample size of 1, and but it got dramatic results. Since I've been taking UPDRS, measuring my Universal Parkinson's Disease Rating Scale, my scores have dropped 70%, which is unheard of, and 50% of my drug dosage. With Parkinson's, through the progression of the disease, you end up taking higher and higher concentrations of Cinemet, and then eventually doesn't work, and then you have to go and switch to deep brain stimulation or some other. But I've been able to restore my alpha wave, which is the meditative state that you go into when you shut your eyes, and was very exciting. And so I have heightened mental acuity, improved sleep, enhanced balance and gait, and reduced off time and reduction of tremors. We have a very talented team of biomedical, solid state physicists, electrical engineers, and we've worked on on very difficult problems related to CAT scanning front ends, and the team has built CAT scanning front ends and patch pump medical devices. So we've been around the medical device technology for a long time. I have my son as COO, and Joseph Kuhn is my CTO, who I've worked with over 30 years, and we have Chris Moe, our fractional CFO. So where we are is we have the initial findings we're trying to verify and validate in a short study. We have been grateful to Lifespan to start working in this area with us, and we have used and leveraged the NEMIC environment to a high degree. We are resident, our offices are in Innovate Newport. We have OctoPD, which has done a fantastic job on coming up with taking our rough prototypes and coming up with a configuration that we believe will work well with our trial. And we're collaborating with URI-based ECHO. I would also like to mention that we have hired Brown students and URI students to do the software, not MIT. And they're doing exceptionally well. I mean, I'm a little biased on the MIT, but I've been proven wrong. We have raised $100,000 to do the short-term study, and based on success of that, we're going to be focused on a larger cohort of 30 to 40 patients, and We're going to leverage the Rhode Island Commerce and NIH as well as file additional patents. What's exciting is that we focused it on Parkinson's, but any hypometabolic state, like degenerative disease like ALS, MSA, Lou Gehrig's disease, will benefit from this therapy. Thank you for letting me share the story.
So I'm opening this up to general questions. So if anybody has a question, just let me know. But for the entrepreneurs, you've got the man with the money, or the man who's trying to get. What in your experience, what would you ask Neil about? You know, what your experience has been, what you need, the support that you've had so far, and so forth. Or what would you say? Not the support that you've had so far, and so forth. Or what would you say?
Device rather than the wet lab is a niche that can grow rather than the wet lab in Rhode Island, because I'm familiar with the wet labs in Cambridge, but the device ecosystem is a good ecosystem. So
It will be and, not or.
right.
It will be and, not
I have a question.
Right.
As you plot this course, is there an opportunity to plot this course? Is there an opportunity to? Is there a strategy to recruit from? Is there a strategy to the sort of greater surrounding area? Not just to use the wet lab, but to sort of greater surrounding area. In fact, not just to use relocate air quotes. Some or all of the business from an adjacent somewhere. So, how are we doing that?
We're all doing that. So first, we have to also have the workforce. We also have to acknowledge some of our challenges, whether it's education or housing or whatever, as far as people coming here. But it's really expanding the network of somebody's doing this and then doing that and doing that, that we're going to do that. And so, you know, I use the story of the small company where they're headquartered here and the research is up at Cambridge. We want to get that research down, and that is one of the reasons for the lab. Working with Aiden as he expands again globally, not just regionally. But when I went up to Worcester to talk to them and their very robust system, you know, the person that was running that, and it's not as competitive, you know, we're new, but they're pretty secure. Talked about a Boston, Worcester, Providence triangle. You know, again, I can get to Worcester from Providence as quickly as I can get to Newport. These things are not far. We've got to get people together on that. But we've got to give them reason to. So I think it's expanding networks that the entrepreneurs have and getting the right people here. You know, love to hear we can find students here from Brown and URI and don't have to always go to MIT. And Roger, well, oh, all of them. Yeah, no, absolutely. And again, when you look at that broad workforce, we're going to get it from a lot of different ways.
When you look at that broadly, explain wet labs and why they're, somebody just, for my benefit and others, explain wet labs.
Wait for somebody to do it besides me. They are, you know, from what I've seen, you can explain it better, it's benches where you actually can do the work. It's equipped, it's got the equipment that's needed. It's not dry in the sense of it's a medical device where you don't have to use chemicals and water. Correct, safety, you've got to be able to dispose of stuff.
So typically, the spaces, and I'm
go ahead.
just to be clear, I'm fully for, you know, having a playing field here with wet labs in it. I think it's, you know, if you don't have anything, there's no chance. And there's a company that we're working with right now who's in Mansfield, in the incubator in Mansfield, and he'd move down here in a second if we had wet labs. So essentially, it's a hooding system whereby chemicals, etc., that may be noxious can be dealt with in a particular way. There is more of a focus. I mean, my sort of facetious thing is it's sort of pills and potions and so forth, rather than this more mechanical world that we live and service-based world that we live in. And that what's important is they are governed by completely different verticals of the FDA. So one is governed by a thing called CEDA, and the other one is CDRH. And so the methodologies are very, very different.
Thank you.
And if anybody can answer that question properly, that was
Oh, thank you.
Tom Hutchinson, who
Thank
does
you. I'm doing another
fabulous work for
presentation
us.
tomorrow, and now I've got a good answer.
So, Dave.
Wet labs are great. Oh, well, I'm all devices are industry. Wet labs are great, they won't help our industry. There is infrastructure within Rhode Island, so that's good. We don't have to start from scratch. There is infrastructure. I'm not aware of any particular region we don't have to start from scratch. It just said, we own medical device everything. And being a little state like we are, you could conceively centralize a lot of the infrastructure that we go to California. I literally go to South Dakota for sterilization, we buy stuff from that company, et cetera, et cetera. There are opportunities, and I'm just trying to promote that device, not pull that by a farm. There are opportunities, and I'm just trying to plenty of stuff that is within the kind of budget I imagine Rhode Island could afford that would not just help Rhode Island companies, but potentially bring business, so I'm not, people like me aren't flying to South Dakota to get business, so I'm not, people like that. Not news, but it does take a bit of a vision for, well, what would that infrastructure? But it does take a bit of a vision for, well, what would
Yeah, and then we need critical mass, because we've talked to people about coming here. They're not going to come here for one reason, that's the thing. So there's a little chicken and the egg there. But, you're absolutely right. Contract manufacturing is another area that we could have an advantage here. Contract manufacturing is our capabilities. We could have an advantage here.
Contract manufacturing would be great.
Yeah.
I mean, we're currently shipping over to China.
Right.
I mean, that would be, assembly and boards. We used to make all the boards, the printed circuit boards here, and they're now everywhere else. But you can see with organic technologies and really advanced, and they can impact their own space.
One of the things that we found, and I didn't really sort of, at Zymedica, we were never Rhode Island focused. We were in Rhode Island looking out across the country, is that within the universities, all the universities have engineering, URI has kinesiology, which is a huge part of device development and so forth. We've got pharmacy schools, etc. So we've actually, while we still, I think, have a brain drain, with more momentum and with a little bit of a declaration, and this is why I'm sort of more declarative about saying we could actually own this. We could we can have something up by the fellow whose name I've forgotten on the top of the State House. What's he called? The Independent Man. We could have something right there saying we can do.
You're saying you personally want to independent man up there? Aid and Peter?
I'll do anything.
So,
So
how do you see health? I'm a device background, right? But how do you see the ecosystem supporting health tech? Because I'm now building my company like beyond, what it was at the seed stage, and I'm running into challenges trying to find tech-enabled health services, people who have any experience in that can build out the technology, help us, automate some of our processes, things like that, and it feels like we've got CVS in our backyard, we've got a lot of reasons why we could also, incorporate health tech. How are you thinking through, not just MedTech, I'm going to raise the flag
Yeah,
for
no, go
health
for it.
tech as well. How are you building out that infrastructure? Health tech as well. How do you think? How are you building out?
So the view I have on health tech, because it's an adjacency to essentially to medtech, and the systems and services that are required in all the hospital systems to actually bring that technology to people is through on the service side, and that is an area that I think can be improved vastly. All the hospitals right now are suffering from not having enough nurses, not having enough physicians. And one of the advantages, if we can continue to froth the pond here and say there is now something that we can train people into the hospitals as well, and with new systems, new services, etc. That's why we've sort of slightly shifted or grown at NEMIC in that we've put the health tech banner in there. Because you can't just have a bunch of things, you need to be able to deploy those things into the human race.
And just so you know,
Deploy those things into the human race.
Aiden and Lydia, are presenting to the Rhode Island Life Science Hub Board. So we put this front and center as far as one of the high priorities. Because the other thing is with our size, we can't do everything. You know, I used to use this expression at the foundational time, we can do anything but not everything. And so depending on who you talk to, like I said, if you talk to the Dean of Brown Medical School, he'll tell you about RNA for the next 20 days. Can we be a center for that? I don't know. And there's a balance between picking winners and losers, but making some smart bets on where we can grow. This would be a home run if we were the medical device capital of the United States. No doubt about it. This would be a home run if we were the medical device capital of the United States. No doubt about it. No doubt about it.
It's costly to renovate. French Beans Factory.
Yeah.
It's costly to renovate it, which was a nightmare. French Beans Factory. It was a nightmare because which was a nightmare. It was a nightmare. Fire department, the building inspectors to actually understand. Fire department, what you're doing. The building inspectors to actually have every time they saw the Disney of what you're doing now, the fighting Melrose. Every time they saw our door and tell us that there was some kind of a door latch at our door, and tell us that there was some overtime, a door latch, what was wrong, we had to pay double overtime over the weekend, while we had a battle. Didn't happen, they got rid of any money coming in. It's a battle. Those guys didn't happen, so there's got to be some training and understanding. Those guys got it. So there's got to be some training and understanding and a welcoming atmosphere for that. Because in the state as well, and I think you have a great opportunity for that.
Yeah, it's a similar story with housing. I mean, you're describing the same type of things. Well, I mean, a lot of those should be turned into housing too, and the same barriers and same things, bureaucracy gets in the way. But you're right, we've got them, they're here.
Any other questions from? Any other questions from?
And small, as you mentioned, so think about this, obviously, you mentioned, think about how we can implement a program statewide, in the United States, that serves the public need, that serves, and that, diversity concerns, you're actually intentional test strips help, and help you actually innovate awesome. So if you think about intentional test strips, help, awesome around, so innovate in certain models, now in certain states. I think we should reflect on that. Innovate in certain models, now in certain states.
No, I think there's when we set up NEMIC, one of the things we did was we said we need to have a place. And I think as the hub goes forward, it is not so much that any individual knows everything, it is that the individuals know somebody who knows everything or knows that specific piece of knowledge. And the more that we can, in gatherings like this, where we know so many people in the room, and know this person, you need this right now, and have a way of facilitating that and streamlining it in a way that's just constant. This is where I think we have that the small state actually can work, because the brain power that is here with the companies that you have mentioned, Becton Dickinson, we've got all the J&J folk, there's all the CVS folk, and we're all connecting. We throw good parties, so it's like, let's get together, know who people are, and sort of recognize them.
You mentioned for a second earlier about the I know. For most people in Rhode Island, when you say that, they look at you, like you got your brother-in-law job and negative. We've got to use it, know a guy or know a woman as a positive to leverage all this, and we don't. It's scattered all over. As a positive to leverage all this, and we don't. It's scattered all over.
Oh, well, it's,
It's more complicated.
it is a methodology that is, if you go to the FDA's website, the CDRH, which is the one that I know best, is a very specific, there is an ISO standard or a series of ISO standards that come with it, but there is a very specific method that you use. It's right on the website. Conceptually it's simple, but essentially what the FDA is doing is putting a requirement on the innovator that a intervention, a new technology has been developed safely, works, and can be used safely. And in those sort of three rather simple buckets, there's a hell of a lot of other stuff that goes with it, because that pertains to manufacturing and stuff. How'd I do, Dave? Was that? But CDRH, drugs I will not speak to, because it's a different world. Drugs I will not speak to, because I'm going to go to Canal and then I'll come over here. I'm going to go to Canal and
I'm from URI, I teach biomedical engineering over there, and I think also working with the startup hiring. First of all, I would like to thank Peter for hiring some of our interns from biomedical engineering, and another thing that we are looking at the next generation. As we teach, another thing that we are looking at the next generation. Many of our students are graduating and they can find jobs somewhere else. Many of our students go out and find jobs somewhere else, not in Rhode Island, and here. And there is a whole new way of what are the ways that we can keep them here. And there is a whole new way of wondering artificial intelligence and data inside of that. So I'm just wondering that what is the, in a life science hub, how AI can be incorporated, interested in the how AI MedTech incorporated in some or even MedTech or.
Yeah, I get that a lot. I had that question, where does AI fit? I called a friend the dean of the medical school, and he gave me very simple. I mean, it's horizontal. It's not a vertical thing that this is just AI. That's up to all of you. We're not promoting. We're trying to identify what the needs are and what works. We're not going to promote one trend or another thing. So we're open to any area. Keeping the people here, keeping the students here is a big part of this. You're not going to get 100%, but they got to have jobs. If we don't have the companies, we don't have the jobs, we can't keep the students. It's that simple. Your old partner made a very famous statement about how to keep college grads here that I cannot repeat in the next company, but I will a one-on-one, and you have it. But you have to make it attractive enough for them to stay.
Don't tempt me.
Yeah.
Don't tempt me.
Actually, my comment is sort of similar. So I'm a chief people officer, and I'm also a professor at Northeastern in Boston, and I straddle Newport and Boston. And, so I think of talent, obviously, all the time. And, I see so many people in Boston, they can't afford it, the schools can't afford it, people live there, want, post-pandemic, want a quality of life change. So I think if we can get the companies and the jobs, I think we can attract people out of the cities with the talent and even experience it, and not just, college students.
Yeah, you can't. I mean, nothing's ever simple, right? So if somebody wants to live down in Jamestown, it's a great place. We can't duck education in this state, right? So if you have a company in Cambridge and we offer everything, we'll set you up for free, we'll give you 3 employees and all that. But you have kids in the Wellesley or the Newton school system, you ain't moving to Rhode Island for the school system. That's a challenge. We have to up our game in a lot of areas to make this appealing. And yes, you can go to the private schools, which get expensive, or you can find other places. But it's a little more holistic. What I found in the people that I've met that have come back here, they either went to school here, their in-laws live here, or a spouse is teaching at a university here. That gets a lot of people. Those 3 categories get a lot of people here.
Or they grew up in Syracuse and the weather here.
Yeah, well, that's right. Yeah, that's right. But the people they want to treat are all moving to Florida, right?
Well, I mean, when we were kicking off Zymedica, we couldn't get any single people to stay in Rhode Island. We just couldn't. Today, I think it's a very different story, and I'm looking at Dave, who's hired 25 people. You're hiring a group. You've got how many now? and the doulas, and then
Oh,
you're
150.
150, so
Yeah.
50 doulas. So these are real jobs existing. And when we looked at all the, and I'm saying this to you, Neil, when you looked at all the hands that went up of all those startups, and they all hire and they all grow, that's a lot of people with good jobs and so forth. So this is where, I think that these probably, you're not going to solve any single one,
Yeah,
but we
the other
could do
thing
it.
is, we've been told, is opportunities. So if you go up to Cambridge, I'm told, in a building, people change jobs in the
Right.
elevator. And so the more we build up the ecosystem, and they know they could come here and work for you for 3 years, and then maybe there's an opportunity for you for years. So it really is, you gotta just lift it up and get the numbers. So
Yeah.
it really is.
Any,
Lift it up and get the numbers.
The first of these
Any
event
lo- oh.
spotlights, so in the first of these event spotlights, very focused on food and beverage, and there was a very consistent theme there that we were missing co-packing. And that was what was hampering
you
growth
started to delve into
that
this and
sector.
you've been sculpting
So
around this for a
as
long
you
time,
started to delve into this,
is there a missing
you've been
piece
sculpting around
in
this
the
for a long
ecosystem?
time?
Dave talk about he has.
Is there a missing piece in the ecosystem? We heard Dave talk about he has to go for
South Dakota.
South Dakota and, is there any obvious, South Dakota and, is there any obvious
Entrepreneurs and investors.
piece of the ecosystem?
The only one out of the blocks, which is what I've talked about a number of times, is the wet lab. We don't have it. We do not have incubator wet lab space in the state of Rhode Island for any new startup. So that's why when the legislature did this, it got to the top, because that's all they heard. That's all they heard. Now we've got to do a better job of finding out whether we should be packing, whether it should be contract manufacturing. We don't have the resources. Our small size is lovely. I've been hearing about the strength of that for 50 years. It also is tough. We do not have critical mass. We don't have the resources. We got to specialize, and we got to be good at a few things. And maybe that's it. Maybe it's the packing, maybe it's the, certain things.
what I'll say is I think the money side for the MedTech folk, because you tend to be outsourcing a whole lot of different things, the MedTech folk are always going to say money. It is access to the right amount of money, and as we go forward, to figure out a way that you can retain a startup here. I mean, my thesis is if you can grow to 5 people in Rhode Island, you are very unlikely to take off, and Dave's certainly not going back to Syracuse. So, so it's like if you've got your core knowledge base here, and if that grant program can do that, then I think we're able to retain all these.
One of the ideas we're going to look at, this is not a commitment at all, but somebody gave me this idea, is maybe co-invest with VCs. So a venture capital firm puts $1 million into their company, and we go in for 250 or something to leverage. We're not going to have the expertise. We're not going to set up a mini VC there. Grants in the right area. That's the mix, and we're welcome any advice or guidance. We welcome. I don't know what it is. It's going to be, it's a fund. Now, I'm talking about a fund that may be out of the blocks, $10 million, not $100 million. So whether that's venture money that we can partner with people, grants, which is my inclination, loans. I heard about a program in Israel where, with tech companies broadly, they provide loans that you don't have to pay back as long as you stay there. Now, that's tying up capital and stuff, so we don't know. But I don't envision, especially in the near future, we don't have the ability to set up staff, what it takes to be a real venture capital. We've got to get more down here. We've got to get people down here from Boston.
We've got to get the companies down, but we've also...
No, I mean the investors.
The investors will come.
Yes,
We give them a reason to come down. They'll come down, and they'll also bubble up in this market here. There are active investors, but you've got to give them a reason to come. Yes. But you've got to give them a reason to come. Yes.
Our perception historically is that here in Rhode Island, it's hard to fundraise, hard to find money here. Melissa and Pat said it yourself, a third of your funds came from Rhode Island investors here. What resources are get that money to investors to fundraise here in town to get that money to investors locally?
Yeah. I would say it certainly needs to grow. So I've been talking to investors for over a year now, and we just closed a round. It's taking longer to raise for everybody, right? But I think I started in Rhode Island when I first started raising. It was like, oh, there's nothing here. Left, went to New York, went to California, got some funds in, and then Rhode Island came to the table after I had a couple funds in. So I think that was, one of the reasons that we got investment through Rhode Island. So it'd be great if there was more seed stage investing that was happening, because I do think my first impression was I need to go elsewhere. But then when I came back with like, oh, we've got some, Silicon Valley investors, then, people came to the table, and we were in a different spot with the business as well, which I think made it more compelling. So there's Cherry Stone, they invest in us. There's Thorne and Slater. You've got Rogue Venture Partners. They're fairly new on the scene, and they're amazing. They have a women's fund as well, which invested in us, that's based out of Seattle. So I do think there's a network here, and a lot of that came from a lot of support from NEMIC and RIHub making those connections. But a lot of them said no the first time around, and then came back around. So I feel like you also have to be persistent and keep bugging them.
All right, are we good?
One little thing, I haven't heard anybody mention, one good thing, and one little reason I haven't heard anybody mention one company in downtown Providence, which is that most of Providence and maybe most of Rhode Island is part of the federal opportunity. And that is a tax advantage, which as entrepreneurs who imagine maybe someday selling their companies, it may make a big difference on the return on investment. A lot of Rhode Island is part of the return on investment.
We also, at one time, several years ago, had an investor tax credit. That would be another way to attract investors here.
Yeah.
And it went away. I think it was done, I don't remember how long ago it was done. But it was done specifically for some transactions. But that's something we could look at too, to give investors a leg up here.
Grand. Thank you very much. Thank you, guys and gals.
Brilliant.